Very good morning to all of you. After Dr. Basavaraj and Dr. Balaji, they spoke, how they've started this fitness journey. And it's amazing that how fitness has to maintain, and they are torch bearers of this. And I too have started my fitness journey, but late in my career, when I was around 30 years old. That time I started this because I was obese throughout. I had childhood obesity and I was obese throughout. But I noticed that when I was giving advice to patients, they don't bother. They just laugh at me. So I thought, why? Means it's something that they're not accepting. So that day only I decided, no, I have to lose weight, I have to work out. And since 2006 to till day, 20 years, it has been going on. So I started with gym. Then one fine day, I saw people cycling in just before the COVID. So that time I started cycling. And I have done cycling for 200, 300, 600 kilometers also from Bhubaneswar to Vizag, Bhubaneswar to Calcutta. We go by cycling in a group. And then I met Manohar. He pushed me for this running, not a Manohar. And we did marathons together. Afterwards, starting running, I did marathon. I did 5, 6 full marathons also. So fitness is something this is irreplaceable. You have to do it. And fitness in any pattern, like Dr. Balaji said, yoga, or Basara said cycling, any form of fitness is exercise is good. It may be yoga, it may be aerobic, anaerobic, cycling, Zumba, dance, swimming, whatever you feel like, whatever you feel, whatever you love, you do it. It's not that it's a prescription, you have to do this or that. It's nothing like that. So, Deepak, can you play the videos? I had a set of questionnaires, I had made it in the video form. And that's why I've started my fitness journey. And if you ask me about my achievements, what I have done, say I have done this, got this BRM, that is Bristol, it's a format of cycling 200, 300, 400, 600 kilometers in a time frame in one session, 6 months. I've done that. And that is a super runner. And then I've done 6 full marathons in Mumbai and also in Bangkok. That is a night marathon, 42 kilometers that I've done. And what motivates you? Motivation is that being fit is you get rid of this chronic diseases, and you can inspire people. And when a fitness person talks to a patient, a fit person and a normal person talks, there's a difference. Patient do not accept that when a obese doctor tells or advises, but when somebody is fit, preach what means. Teach what you do, okay, so that if you are fit, people will accept you. Hi, yeah, that's a good question. Way back in 2006, when I was a resident at Dr. Mohan's Diabetes Specialty Center, Chennai, I used to give medical nutrition therapy, the dietitics advice to the diabetic patients, and I was not sure whether they're convinced or not. So back that night, I thought to myself, what I'm saying, why they are not convinced? And again, that thing struck to me that I myself being obese, my BMI was something around 32 kg per square, and I was obese. And being an obese doctor, giving advice to the patients, how can they take it? So that night, I decided that I have to lose weight, I have to work out. And the very next day, I've joined the gym at Chennai, and from there, the journey started, and it's going on till now. It will go on. Yeah, being discipline is the most difficult part of the fitness journey. And my fitness mantra is my Coco, that is my main dog, wakes me at morning 5 a.m. And I'm taking for a walk, and after that I start my workout. So find your Coco. you.
Very inspiring efforts and their workouts. So, being doctor, we have been only prioritizing our practice and we have been only advising. We are not practicing. So, we see all these doctors have been inspiring. They have been doing their routine exercises to keep fitter. So, not only like not talking about that doctors are very unhealthy, they don't take care of their health. We have to invest into our health. So we have to spend a little bit of time. The most important thing is like whatever exercises we have been doing, the most important thing is to have it consistently. So we may have some breaks in between, but we have to restart. And one more thing, monotonous exercises are also not that favorable. You have to do multiple ways of doing exercises, maybe like yoga, cycling, or weightlifting. Any form of exercise is good. And what I believe is not only working out an hour in the day and the remaining entire day being very sedentary. So most of our doctors, we use the chamber. We sit in the chamber, only see the patients. We sit almost like 6 to 8 hours. So not much of any physical activity. See, the way I practice is, I have 4 chambers in my clinic. I put patients in all the 4 chambers. I move from one chamber to the other. So that makes around 4 to 5 kilometers of walking within the clinic itself. So my walking is done within the clinic. Apart from that, I am into all sport, gymming, everything. So we always try to advise patients about exercise, but we don't follow. And most important thing is not only like everybody can afford to go for cycling or working out in the gym or yoga. Day-to-day activities like going to the market, carrying some weight, like walking to small, shorter distance places. Nowadays we have started using more of gadgets, spending time with the gadgets, wasting our time. Maybe we can use that in a different form, someone wants to do a treadmill, can watch a movie along with treadmill. Do something like that so that we are mobile throughout the day, physically mobile throughout the day. Any questions, anything you wanted to add on? Yeah, please.
Analytic. Okay. So, doctors, we have to do daily SIP. All of you know SIP, mutual fund, systemic investment plan. So that what our doctors fit doctors. One, we should be a model for our patients, number one. Number two, daily SIP. SIP means start at 4 o'clock or 5 o'clock. And with that, I have reduced 15% of my body weight. I was 70, now I'm 60. So I did it, and daily I spend at least 1 hour. What sir has suggested, multiple baskets. Mutual fund we do baskets, different places, equity, short term, long term, all these terms are there. So different games, cycling, swimming, whatever you like. Yoga is a must, what sir has told. And this is my suggestion to all the doctors, and we should live 15 years. I think a lot of studies are showing 15 years we are less than the national average of 73, 74. So we should be above 74. Our average lifespan of all the doctors should be above 80. So is all the doctors good and to become fit. Thank you.
At the end of the...
Sir, I just want to add one thing. I heard somebody like you that
spend the first hour of the day. Be very selfish to spend the first hour of the day for yourself. Then start everything.
See, we are doing, all the doctors, we are doing for the other body sake. But for our body, we are not spending. At least spend for our body at least 1 hour. Spend any activities for our sake. Then only the other will be well-being. And also, at the end of the day, we are not taking anything. We are living here only for at least we have to be our fit. Then only the society will be fit and everyone will be fit for our this thing. Thank you.
One more thing I wanted to say, sleep is very important. So don't sacrifice your sleep for your exercise. At least make it around 7-8 hours of sleeping, then remaining can use it. Yeah. Somebody wants to add?
No, I just was admiring all the fitness level of all 4 of you guys. But kudos to you, you have done it. And I think, have you noticed that when you share your fitness journey with the patient, you feel there's an impact or there's a change in the behavior of the patient and you can make more impact? And number 2 question is for Dr. Balaji. How many minutes do you do yoga in the morning?
So to answer your first question, definitely if you are a role model for your patient, then they do tend to follow your advice, right? So there are many patients who I feel that I have inspired. They in fact ask me what is my fitness regime. Even my diet, I'm very strict on my diet. My diet, first thing in the morning, breakfast, I'll have this health mix, which is a mix of lot of millets, pulses, also it's a rich mix of proteins, complex carbohydrate. With half liter of milk, I'll have some egg whites and lot of fruits. That has been my breakfast for years together. Hardly I'll have an idli dosa sometime, and I don't have any rice at all. So I think diet also plays a very important role. Now coming to the second part, I do yoga for at least 35-40 minutes, which includes, I do Kapalbhati almost 700-800 times. Anulom Vilom is almost around 80 to 100 times. Brahmari is about 30 times. And then I do the asanas to end with. So all put together about 40 minutes daily in the morning.
Thank you. Thank you for giving opportunity. Disha team and also Dr. Manohar.
Thank you so much, doctors. We request the chairpersons and the speaker to move towards the selfie area for a group photo and the memento.